Good morning. This is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. Joining me today for this edition of the Schaffner Report is NFID Medical Director, Dr. William Schaffner. The month of May has been designated as Hepatitis Awareness Month, and today is Hepatitis Testing Day. To help raise awareness of this serious disease, this edition of the Schaffner Report will address the differences between hepatitis A, B, and C, and steps that individuals can take to help protect themselves. Bill, we really appreciate you taking the time to talk with us today, so let's jump right in. Viral hepatitis is sometimes called a hidden epidemic. Why is that, and what should people know about hepatitis?
So, Marla, viral hepatitis is caused principally by three viruses, hepatitis A, B, and C. Each of them is distinctive. Each of them is a little bit different. And interestingly enough, two of them are preventable by vaccines, A and B, excellent vaccines, as a matter of fact. And we now have treatment for hepatitis C. So it's important to know about these viral infections. They are thought to be a hidden epidemic because, first of all, we haven't talked about them very much in recent years. Second, some of these viral infections can smolder for a long period of time and have long-time consequences after the person has been originally infected. So let's look at them very quickly. Hepatitis A is actually a virus that you acquire by ingesting contaminated food or water, usually, or by close personal contact with someone who's got the infection. It may not cause an illness or only a mild one. That's particularly true in children who hardly ever get really sick, but can transmit the virus very, very widely and readily. That's one of the reasons it's a hidden infection. Adults, of course, get an illness that affects the liver and inflammation in the liver. It causes nausea, vomiting, fever, you feel badly, and characteristically you get jaundice. That is, there's a yellow cast to the skin and the whites of your eyes can turn yellow. Almost everyone recovers from this illness, but it can make you sick for a substantial period of time. Hepatitis B and C can be thought of together because they are classically blood-borne infections and can be transmitted sexually also. This is particularly true of hepatitis B, which can be transmitted through close, intimate sexual contact, as well as needle sharing, and can also be transmitted from a mother who's infected to her newborn child. So neonatal transmission is very important in maintaining this infection in the population. And hepatitis C is almost completely transmitted through illicit drug use and needle sharing. So B and C, excuse me, can have long-term chronic consequences down the road that can lead to liver fibrosis, which we call cirrhosis, decompensation, dysfunction of the liver, and can ultimately actually result in cancer of the liver. So all of them important diseases. Interestingly enough, both hepatitis B and hepatitis A have seen increases in recent years, despite the fact that they're vaccine preventable. Hepatitis A has been seen in a large, really rather nationwide outbreak among homeless people, which caught us all by surprise, making some of those people really very, very sick. And hepatitis B has increased as a consequence of the opioid abuse epidemic that's out there with its consequent needle sharing, particularly in young and middle-aged adult populations. So both of those increases have rather surprised us because previously the occurrence of these diseases was diminishing in the United States, but now we have an upswing, making vaccination against both of those diseases more important than ever.
Very interesting. So, Bill, who should be vaccinated against hepatitis A and B?
Well, for starters, all children are vaccinated or should be. It is recommended that they be vaccinated in the United States against both hepatitis A and B. And hepatitis B immunization should begin actually for all infants exactly at birth. You should get a birth dose. That's very important in preventing the transmission from a potentially infected mother to the baby. We'd like to test every mother during their pregnancy, but we miss testing many mothers because they don't get good prenatal care. So we have decided as a society to just immunize every infant, and that really has worked profoundly as a strategy in reducing mother to infant transmission in this country. And then, as I say, all children through their adolescence should be vaccinated against both hepatitis A and hepatitis B. These are excellent vaccines that will give you essentially, we think, lifelong immunity if the vaccine sequence is completed. And as these children grow up, obviously they will bring their protection with them. But in the meantime, there are many adults that remain susceptible against hepatitis A and hepatitis B, and there are a series of recommendations regarding their vaccination. In brief, against hepatitis A, we should all immunize travelers who go internationally to countries where there is a great deal of hepatitis A, but also men who have sex with men, people who inject drugs, everyone with chronic liver disease. It's not that they're more likely to get the infection, but if they do, it's much more likely to be worse on top of their chronic liver disease, exacerbating it. Everyone who's homeless and everyone who has HIV infection. Regarding hepatitis B, the list is also rather long. As I say, we're vaccinating all infants and children. And then when it comes to adults, those at special risk include healthcare workers. So essentially everyone who's newly in the healthcare professions is getting vaccinated. People who have sexual exposure, this can be transmitted sexually. So if you are not in a long-term, committed, monogamous relationship, you should be vaccinated against hepatitis B, and particularly so if you've had more than one sexual partner in the last 6 months. People with chronic liver disease likewise should be vaccinated, and people in certain confined high-risk circumstances, prisoners, people who are incarcerated. And then once again, we'll talk about travelers and persons with HIV infection. So the lists are rather long, but these are individuals who, as adults, are at increased risk of either hepatitis A or hepatitis B.
So there's no vaccine for hepatitis C. So why is testing so important, and who should be tested for hepatitis C?
Testing is very important for hepatitis C because we now have treatment that can prevent the long-term complications of cirrhosis and cancer. The screening recommendations are remarkably broad. I said before that you acquire this infection because at some point you used drugs, shared drugs, used needles, and shared drugs illicitly. That's often a history that your patients won't give you. Indeed, some physicians find it uncomfortable to ask about them. So the CDC has recommended that all adults, everyone 18 years of older, at some point in their life should get hepatitis C screening. And then particularly women should get screened during each pregnancy. So those are rather simple recommendations. They're very comprehensive, And frankly, they're only partially being followed up. I think many physicians and other healthcare providers do not recognize the broad sweep of these recommendations, so that no matter how refined or how well you know certain patients, and you think, oh, they've always been on the so-called straight and narrow, the CDC recommends that all adults at some point should be screened against hepatitis C.
Great. Bill, can you tell us a little bit about what new developments are on the horizon around hepatitis?
Well, certainly the expanded recommendations for vaccination for people who are HIV infected and homeless for hepatitis A, that's very important. The recognition of how important it is to really seek out everyone who is eligible for hepatitis B, because that the incidence has increased. There's also a new hepatitis B vaccine that has been licensed. We're all familiar with the long-standing traditional 3-dose sequence of hepatitis B immunization. There's now a 2-dose vaccine. It's been recognized that there is as you can imagine, a fall off in compliance with all 3 doses, the last dose having to be administered at least 6 months and beyond that after the 2nd dose. And patients don't come back, and physicians and other healthcare providers may not remember to give that last dose, and some patients don't even come in for the 2nd. So anything we can do to compress the immunization schedule is a good thing. And there's a new hepatitis B vaccine out there that requires only 2 doses.
Great. So before we close out, Bill, are there any last comments you'd like to share with our listeners?
Hepatitis generally, A, B, and C, have not been in the news recently. Obviously, we've all been concerned about COVID. Yes, it's a silent epidemic. So I think this is an opportunity during this time, hepatitis week, when we need to re-emphasize the importance of these diseases and organize our practices so that we can reach out and make sure that we immunize as many people as possible with the hepatitis A and hepatitis B vaccines. They are very effective. They are very, very safe. They have long histories of working very well. The new hepatitis B vaccine is also extremely convenient because it needs 2 doses. So find those patients who are eligible and let's vaccinate them.
Perfect. Thank you so much, Bill. Really appreciate your time and hope you all have a good day.